Hi, I'm Robert White at the Washington Institute of Natural Medicine. We have a lot of treatments going on here, so we have to keep our voices down. We have Reiki, chakra balancing, massage therapy, acupressure, acupuncture, classes, and all types of things. But I'm going to tell you today about manual therapy. So let's go in and see our client and see what we can do with manual therapy today. Today we're going to talk about manual therapy with our client here. Juan is going to help us out. And manual therapy is a physical treatment primarily used by massage therapists, chiropractors, and osteopaths to treat musculoskeletal pain and disability. It is most commonly used in manipulation of muscles, joint mobilization, and joint manipulation. Now, some of the techniques we're going to use is dealing with orthopedic massage, myofascial release, osteokinetics, athletic and sports massage, Feldenkrais, Bowen technique, and my favorite, myoskeletal alignment. Juan, will you lay down now, please? So one of the things we're going to do is called longitudinal stripping. Take the forearm, for instance. I manipulate the muscle and I slide my thumb down, stripping the muscle of lactic acid and other debris that could be caught in the muscle tissue. Now we're going to do something what I call dual muscle separation. So with the motion, what we're doing, separating a two-headed muscle. Separating the two-headed muscles allows you to get debris and stickiness from between the intersection, if you will, of the muscles. Another great technique to use for tight muscles is called post-isometric relaxation. This allows the Golgi tendon to reset, allowing the tissue to be elongated. So I'm going to ask Juan to resist me 20% while I push forward and count to 8. Go ahead, Juan, resist. 1, 2, 3, 4, 5, 6, 7, relax, and 8. Now we're moving it to the next barrier. This continues until we have a full range of motion. Another technique I love in myoskeletal alignment is when you check the facets of the lumbar section. Juan is laying down on the side, and whenever you're laying down on the side, you have to keep the vertebrae aligned. So we put a pillow in between Juan's legs, and we also ask Juan to hug this pillow so it supports his shoulder so it doesn't drop down. In fact, footnote, this is the way you're supposed to sleep at night. So what I'm going to ask Juan to do is I'm going to ask Juan to continue to put his knees to his chest. Go ahead, Juan. Up and down, down, up and down. And what I'm doing is I'm feeling for a dysfunction in the vertebrae, in the facets of this vertebrae. This is an assessment test that will tell me exactly what's going on in his vertebrae, and we can plan a line of treatment that's adequate for his condition. Another technique I like is called active stripping, when the client actually assists you in moving the muscle part so that you're able to strip the debris out of the tissue. What I'm going to do is ask Juan to lift his head up and turn your head to the table and put it down. Pick your head up, turn it towards me. Slowly turn it towards the table. And as he's turning it towards the table, my fingers are actually sliding down his muscles, called the SEM. Thank you. There you go. And that's active stripping. And one more final myoskeletal alignment technique is called translation. Translation is when you hold the head, put your fingers on the cervical facets, take the head, and you move back and forth, manipulating the cervical vertebrae. This is called translation. For more information on manual therapy, visit us on our website or give us a call here at the Washington Institute of Natural Medicine.